We are live here from HCIC, the Healthcare Interactive Conference in Las Vegas. We're actually in a breakout room prior to the conference starting off, but it's such a very important conversation we want to have today because, Sandra, you are going to be honored today with a very wonderful award. We'll get into that in just a second, but I would love for you to introduce yourself to our audience. Tell us a little bit about yourself, your background.
Absolutely. Well, first of all, Chris, it's wonderful to be here with you, as always. Any opportunity that I have to hang out with you, I will take it. So thank you for your time today. I'm Sandra Mackey. I'm the Chief Marketing Officer for Bon Secours Mercy Health. We're headquartered in Cincinnati, Ohio, and we have operations globally all over the world. In countries like Ireland, we're the largest provider of healthcare services in Ireland. We are also in Peru, in South Sudan, in the Philippines, and so very broad, expansive ministry that provides healthcare services across the globe. Thrilled to be here, and my background, I've been in healthcare for, I hate to say it because it really does date me, but about 30 years, which is crazy to think that I've been around that long. Have I seen some changes over the course of my career? Absolutely, I have. I've worked in for-profit, in non-profit environments. I spent about 10 years outside of the healthcare space. And frankly, I think that was really just a pivotal moment for me to really look at engagement, consumer engagement through a different lens, and then bring what I'd learned in that environment back into healthcare. I've worked at Emory Healthcare, I've worked for the Arthritis Foundation, that is a organization that does a lot of advocacy work across the country. So very broad and diverse background, but I've been with Bon Secours Mercy Health for about 8 years.
For 8 years.
Yes.
And I mean, that background really illustrates sort of, what many of us in healthcare, we don't really have that context. 30 years in healthcare.
It's crazy.
And only recently, I would say probably in the last maybe 5 or 6 years, we've been talking about advocating for the consumer, being the voice of the customer.
Absolutely.
Yet this is something you've been doing for years in other industries or other parts of the healthcare industry. Is that fair?
For sure, absolutely. And when you think about healthcare, consumers, as they consume healthcare services, they think of it in very much the same way that they do any other industry that they engage with, right? Telecommunications, the airline industry. When you think about how easy it is to do business with those organizations, we have to scratch our heads and say we've got a lot of work to do to really catch up in healthcare, and we're making significant strides. This is probably the most progress that I've seen in healthcare in my 30 years here.
Really?
With the advent of AI solutions, many different solutions that engage the consumer, I think we are really, really breaking new ground in so many different areas, and so it's a very exciting time to be in healthcare.
It's really the age to embrace
the
consumer,
absolutely.
right? To embrace consumerism in healthcare.
Yeah.
And I think that that's something that, I've been in the space for 15 years, and it was really challenging at the beginning because it was very much like you beat your own chest and you talk about your doctors and how great they are.
Absolutely.
Not that they aren't.
Yes, they are.
But really, when I think of the consumers or people, patients in the journey of care, they're in a different space. They're in a different mind space, and they don't really want to see those billboards of doctors with their arms crossed in white lab coats. Is that right?
Oh, absolutely. And when we think about engagement, there's so much to be learned from each other in the healthcare space, as well as from other industries, right? And you're absolutely right. Like the pictures of doctors in white coats with their arms folded or hands clasped together. That is not what engages consumers today, right? They've become so much more savvy about what they want and how they want it. And so for us, this is really an opportunity to lean in and meet consumers where they are. And I know we talk about that a lot in our industry, but there's been no more time than now that is more pivotal in our history to lean in and really help consumers navigate through the healthcare system. It's very complex. There are no industries that are as complex as us or rely on so many outside forces to support it. When you think about consumers and how they engage in healthcare, there's a lot of things for them to consider. Their healthcare insurance often drives them to where they're going to receive care. Their drug treatment plans, so the industries are converging. Pharmaceutical industries, the provider industry with the payer industry, they all have to converge, knowing that this patient is in the middle, relying on each one of them to do their part. And so there could be no more time that is more critical for us to really lean into how we make that easier for consumers to access our services.
A lot of people say that, we want to try to adopt patient-centric models. I don't like to think of the patient in the middle, like you just said, because I think the patient actually, in many cases, leads. So I like to adopt the terminology of patient-led healthcare.
Oh, love that.
How do you react to that?
I absolutely love it. And, for people that love to be in charge, the healthcare decision makers, and I won't say who that is, but we can all figure that out. We like to take control of the things that we purchase. We like to take control of the things that are meaningful to our families. And so when we are patient-led is a much better description of where patients are coming from in that journey. And we want to walk alongside them. We want to innovate in ways that we could only have dreamed of years ago. The kinds of things that are on the horizon are just mind-blowing and so exciting that how could we not lean in? We need to embrace that technology. Embrace AI solutions, not fear it, but guide it, right? To make us,
I like that.
Don't fear it, guide it.
Right.
To be more insightful and look at ways that we can break down some of the barriers that exist in healthcare today.
I think how you're talking and what you're saying and your perspective is part of the reasons why you're here today, because I want to acknowledge that you are going to be the recipient of the John A. Udies Award today.
It's mind-blowing to me. John Udies was a pioneer in this industry and a very dear friend. I had the privilege of speaking at John Udies' funeral many years ago, and I remember thinking at the time, what can we do to honor the great legacy that he had built and the ground that he had laid for us? And I remember thinking, what we can do is continuing to do what he did, push boundaries, ask the right questions, advocate for the people who are accessing our services, and be passionate about it, be unapologetically passionate about the way that we drive to deliver results for the people and communities that we serve.
I can't think of someone more deserving than of this recognition today, and I'm happy to be here to celebrate with you tonight.
Thank you so much.
That'll be happening very shortly here.
It will. I'm still pinching myself, to think that my name is mentioned in the same sentence as John Udies, truly one of the greats in our industry. It is profoundly meaningful to me, and I am beyond blessed to be in this position.
Well, that's nice.
Yeah.
So Sandra, I look out at many of the people attending here today, and some of them are very young and new, nascent in their careers.
Yeah.
Having your experience and looking back over the 30 years that you've been in this space, what advice would you give them?
Great question. The advice that I would give to young professionals is really to understand why they're doing this work and to take their expertise and continue to push for change. Our industry is at a pivotal moment where it is transforming and it is long overdue. The transformation is long overdue. The young professionals in the room tonight, they are going to be at the center of really a lot of that transformation. And what I encourage them to do is be bold. Be bold in their execution and not be afraid to fail. My biggest successes in my career have come from my biggest failures, truly. And I embrace them. I'm the first one to poke fun at myself, and I think about what I say to my team often is, if you're not failing, it means you're not really stretching yourself far enough.
Or not really learning.
Not really learning.
Right.
Because when you're safe and only traveling a safe road that has already been traveled, you're not innovating.
Yeah.
And what I want to see is real innovation. I want my team, and I advise young professionals, keep bringing those big, bold ideas, and don't worry about whether they work or not. Don't worry about if you fail. If you're not winning, you're learning.
Yeah.
So every time that you do fail, you've learned something very valuable.
Such a great perspective. Okay,
Yeah.
I've been asking everyone I've been interviewing here the same question, and I'd love to hear your thoughts on this. Okay, looking forward, what trends do you see today or in the future that are going to reshape our industry? And by the way, bonus 20 extra points if you don't use the term AI.
Oh, Chris. Now, that was a trick question because we all know that the things that are really shaping our industry going forward, I won't use the word AI, I'll tell you what. It's the large language models that we're creating
I love it.
to keep learning about the things that we're doing every day. And, okay, then I'll take the bonus points away. I'm going to use AI. We all know that this is a pivotal moment for artificial intelligence and the way that it's incorporated into our lifestyles every day. It's been around and been emerging for a long time. We're now seeing sort of this real penetration of AI infused into just about everything that we do. And before long, we're going to be in a position where we're asking the question, why isn't this AI enabled? I don't think it's going to be, is this AI enabled? The question will be, why isn't it?
Right.
Because what we are gaining and learning from it, we're seeing breakthroughs that are accelerated at a far greater pace than humans could do it by themselves. There will always need to be governance and guidance around AI in ways that will really protect individuals and protect intellectual property. But with responsible use, this is a pivotal moment in which we think AI can really break through. Think about disease management. Think about some of the things that have plagued our industry. Behavioral health. All of the ways that we have really tried to innovate around those disease types. Think about the opportunity that lies ahead with the implementation of AI across the board.
Yeah.
I'm very excited to see what we can do and how fast we can do it.
Well, I'll still give you the bonus points.
Thank you. I appreciate it.
Well, Sandra, I'm so glad we had a chance to sit down.
So am I.
I'm going to be celebrating with you later, but I'm
Thank
also
you.
very honored that you're not only in our industry as a colleague, but also I can consider you my friend.
Oh, same,
So-
Chris. Thank you so much.
Thank you.
Great to be with you.